Hello, myself Dr. G. Shanmugasundar. I'm a consultant endocrinologist at Chennai. So today I'm going to give information about this diabetic awareness and education. So we all know that India is a diabetes capital, and I'll say this. Unfortunate to say this, that India is the second country to have a more number of undiagnosed diabetes patient after China. So as per the data, number of people with undiagnosed diabetic population is almost 43.9 million in India. So that is almost 4 crore populations has not been diagnosed with diabetes, even though they have abnormal blood glucose. And the diabetes prevalence has increased tremendously. If you take 4 to 5 decades back and now, both in rural and urban area, the prevalence of diabetes has increased from almost 2 to 3% to almost 15 to 19%. That's almost a 5 to 6% increase in the prevalence. But still, there is a lot of unawareness among the public. So now this 2021 theme for World Diabetes Day, we know that November 14 is the World Diabetes Day. The theme is Access to the Diabetes Care. So now I'm going to talk about why the diabetes awareness and education is very, very important for Indian patients. So if we see 43% of the general population in India had heard about a condition called diabetes, but 60% of the population in urban or rural area, people with diabetes, I'm saying, they would not have checked their HbA1c in the last 1 year. So HbA1c is a very important investigation to say that the patient blood glucose is under control or not. But 60% of the diabetic population in both urban and rural, it's not only rural area, even in urban area, they would not have checked their HbA1c in the last 1 year. And almost 50% of the diabetic patients were not aware of the importance of self-care in diabetes. So again, diabetes is a very chronic disease. It's not possible for the doctor to follow the patient on day-to-day basis. So the patient has to do self-care, but 50% of the people are not aware about the importance of self-care in diabetes. So what is the solution for this? So it's important that if you have any symptoms, that is yearly symptoms for diabetes, or even if you have a high risk for developing diabetes, that is the family history is very high, family history of diabetes is there, and if you're obese, or if you have any symptoms of diabetes like increased urination, increased thirst, etc., it's always better to meet the doctor as early as possible, because good lifestyle modification and starting treatment early is going to benefit you a lot. So it can change the complete course of disease itself. So the glycemic control will be good, and it also prevent you from developing complications like heart problem, kidney problem, or the brain stroke related problems. All can be prevented if you start the treatment early in the course itself. And another thing is, you are going to take less number of medication if your lifestyle is good and if your control is going to be better from the start itself. And second thing is, take medication regularly as prescribed, because it's very important. The compliance is also very important. As I told, it's a very chronic disease. So the taking medications according to a doctor's prescription is very, very important. Now the cost of the medication has gone down tremendously, because multiple pharmaceutical companies are offering medication at affordable price for India. So if we compare to the Western these countries, the cost of the medication is very less in India. And in India also, particularly in India, many pharmaceutical companies are giving the quality medications at affordable price. So if you have any problem, consult your doctor so that your doctor modifies the prescription accordingly. And regular diabetes checkup is very, very important. So the self-care is also very important, and regular diabetes checkup, particularly if you have to measure your HbA1c levels, and periodically you have to see whether your kidney is okay, your urine protein is okay, whether your eye examination yearly is very, very important. So all those things are very, very important. So based on these various parameters, your doctor will change medication and doses. And so proper follow-up is also very, very important. So hope this message is useful for you all people. So to summarize, nowadays the diabetes care has changed tremendously. So know the symptoms so that you can, as early as possible, you can go to the doctor and start taking the treatment. And as much as possible, get educated about what is diabetes, what is self-care, and try to do at your home itself. And also do regular checkup with your doctors, and take the medication sincerely as prescribed your doctor. If you have any side effect or cost is a concern, always consult your doctor so that they will make the changes. Thank you. Thanks for